Welcome to June 23rd, Tuesday, June 23rd media advisory and update and broadcast. And thank you to our American Sign Language interpreters, Rosalie Visers and Georgia Whalen. And I just want to thank them at the front of this because we're going to go to closed captioning into the future, and we will not need their services any longer, but we still need a service in terms of closed captioning and translation. So thank you, Rosalie and Georgia, for all of the work that you've done doing the interpretation, the American Sign Language interpretation for us all the way through this process. As someone said a minute ago, you're part of the team and of communicating all the important messages we've had to communicate, and we thank you so much for your ongoing effort to make that happen with us. This is the last media briefing for them, so 3 months of unwavering support at our briefings and town halls, and I'm going to miss you. But hopefully we'll connect again and talk over all of our 3 months of work together in the near future. I also want to do a special shout out. You might notice that I've had a haircut. I want to thank my barber who's been bugging me for months about Fred, when can we open? Fred, when can we open? Mario Giantomaso did a terrific job, and I know that many in our community got their hair done, cut, or styled or colored, and it was just one of those issues of the reopening that I think made very many people happy, whether on the employment side or on their ability to get trimmed up as they've been wanting to do for quite some time. So Mario, my hair is off for you. So some provincial announcements that are made recently is on Wednesday, Toronto and Peel region will move into stage 2 of reopening as well. As we know from our reopening on Friday, stage 2 of reopening means restrictions eased for restaurants, patios, barber shops, Mario, nail salons, malls, swimming pools, and more. And as for the next steps in the reopening plan, Finance Minister Rod Phillips shared that details on stage 3 will be coming soon. Not sure what soon means, but I imagine it's a matter of weeks, not months. So stay tuned in terms of what it looks like. That doesn't mean it's going to happen, but it does start to indicate what stage 3 opening might look like into the future. In terms of city updates, yesterday, the Greater Toronto Hamilton area mayors and chairs, myself included, met again. We're doing this weekly now to discuss our commitment to successful restarting and reopening of our economy, and also on the increased demands on municipalities and our services, and our loss of revenue and significant loss of revenue due to the pandemic, and significant added costs that we've incurred as a result of the pandemic. So we continue to meet, we continue to talk about the very important budgetary issues that we're going to be facing towards the end of this year. And we continue to advocate with our local MPs and MPPs that we need their support. We need an offsetting contribution to municipalities that have borne the brunt of the financial issues in cities. For Hamilton, it's right now estimated at some $60 million, and it varies by degree in various municipalities. But the reality is that it is a negative on any future recovery if we don't get some assistance from our federal provincial partners. And I know that those discussions are ongoing, and we are optimistic that they will not miss this opportunity to help municipalities and in fact help all of you not have to bear the brunt of that additional costs locally, and that it can be spread across the country. The future of our economy, of course, relies on cities, having a good kickstart recovery, and certainly we hope that that will happen as a result of their assistance. In stage 2, some of our attractions and heritage institutions are now permitted to reopen with restrictions, of course. That means on Wednesday, July 15th, Dundon Castle and Kitchen Garden, Hamilton Military Museum, and the Hamilton Museum of Steam and Technology will reopen to the public as per the gradual recovery section of Hamilton Reopens. So it's not immediate. There are many things that need to happen as we reopen these things. As you know, the same issue applies to our splash pads that aren't instantly open the moment we make the announcement, but are gradually reopening when staff can get to them, because it's not just a matter of flipping a switch. Each one of them needs some preparatory work and maintenance, as do our museums as they open up to ensure that the proper protections are in place for not only the employees, but for people that are accessing those museums for their entertainment. So bear with us. July 15th is the target date for those museums. The balance of the museums will remain closed until further notice. And obviously that remains to be seen, but we are hopeful that at some point down the road, all of our great facilities will be accessible, but we're certainly not there yet. And Canada Day is also around the corner. And a quick reminder that we have a number of fun initiatives planned to help bring Hamilton together from a distance this Canada Day. So for all of those details, visit hamilton.ca/Canada Day. We have a great lineup of program for you, sponsored by our annual sponsor, RBC, Royal Bank of Canada, is the returning sponsor and has been doing that for 6 years now. We're very grateful for that. It'll be a little different this year. It'll be virtual, but still entertaining, and a great program put together by Sonic Onion for us to enjoy, and they've done a terrific job of producing this event. So stay tuned on that. Visit hamilton.ca/Canada Day to get details on how you can celebrate together virtually on Canada Day with some entertainment put together by Sonic Union and sponsored by the RBC. And on that note, I'm going to turn it over to our EOC manager, Paul Johnson, for any updates from the EOC perspective, and then I'm sure he'll turn it over to Dr. Tran for any medical of health, public health updates. Paul?
Thank you very much, Mr. Mayor. And I'd like to start where you did today and really thank Georgia and Rosalie for all of their efforts. Some decisions in those very early stages of this crisis were easier than others, and bringing them into the fold was an easy decision. And they really have been part of the team. And on behalf of all of us who are trying to provide good information to the community and make sure as many as possible are able to access good information, I really want to pass on my thanks, not only on behalf of myself, but all of us at the Emergency Operations Center. So thank you very much for that. In terms of things happening at the city, we're entering into this phase 2 of reopening, which is, as the mayor has indicated in the case of museums and things, where we're talking about things reopening, but it's over a period of time. We're now having to get back into the how do we get facilities back up and ready to operate, and they can't just, it isn't as easy as unlocking a door, flicking on the light switch, and away we go. And one of those examples is with our pools. So we did announce that we're going to be opening 14 pools, a variety of indoor and outdoor pools, and that is not the sum total of pools of the city of Hamilton. There's actually 36 pool facilities, if you include all of our wading pools as well as our indoor and outdoor pools. And of course, we're talking about 14 of them. We did look at size. We did look at the ability for us to meet public health standards and guidance around this, and of course tried to spread them out across the community as well and get the most what we call bang for our buck. So some of our wading pools, for instance, are not open for very many hours at the best of times. So in terms of where we put our energies and priorities, it was those facilities where we could open them for longer periods of time. I know there's been a lot of concern and some disappointment that not all of them have opened, and I do want to say that we don't plan to at this stage open any more pools. We're looking at those 14, and that is where we will stay put for now. And in fact, we're targeting the week of the 6th of July and the week of the 13th of July for some of those openings, and that's if everything goes well. We have a lot of staff training to do to ensure that our facilities will be safe and properly cleaned, and that our lifeguards will be trained for any instances where they do need to provide life-saving endeavors in their pools, and that training takes time. And then of course we have to get our facilities ready, which takes time as well. So patience please, and we do hope that we can meet those timeframes of July the 6th. Another thing that we've been getting a lot of questions about is that amateur sport can return to using sport fields for training only, and a lot of groups have been interested in that, because in the absence of being able to do all of the activities that you would normally see in the summer, it is great to get our younger athletes and and some of our amateur athletes back out onto our fields, and of course getting some exercise. And in the training function, that's great as well. We are working very quickly through our recreation division to permit these activities and get those field permits out. And our target is to get that done by about July the 3rd, so just after Canada Day, so that people can get going. And that's actually a little faster than we had anticipated earlier on. So a big tip of the hat to our folks in recreation, who alongside trying to get pools up and going, alongside trying to shift our programming, our summer programming, are also making sure that our partners in providing sport in this community can also make sure that they're able to do what they can. So again, want to reiterate that this is for training only, so there won't be any scrimmages or any games or any leagues happening at this stage. This is just a chance to get out and train, which is an important part of the whole sporting endeavor, and we want to support that. The other thing I'll say is we are at this point only permitting for daylight hours, so there won't be permitting for any hours that would take us into the night hours, where we would have to turn on the lights in those facilities. As I mentioned, Rec is still working on our summer programming. We will have some kits that people can take home, full of great work that people can do in their own homes with their children in terms of recreation. We have lots of great online resources, and we will be doing some work directly in parks, which is great for us too. So it'll be a nice opportunity for us to do rec a little bit differently this summer. And again, the disappointment of some of the things that aren't there, I get and I understand, but I do give credit to our recreation division for being creative in terms of the way they can go forward and provide some different types of activity in the summer of 2020. We really expect that the timing this year of the coronavirus crisis and the early part of this pandemic really just has had to curtail a number of activities, and this is definitely one of them. And we'll be reminding you a lot over the coming week and 2 weeks that we're moving to fare collection on our transit system as of July 1st. We are in a situation where we're asking people to wear masks, not as a recommendation, but as a thou shalt. If you're able to wear a mask, please wear a mask on our transit system. And then we will be moving towards fare collection on July 1st. And more information will come forward as we get closer to that. And it is, again, an opportunity for our transit system to get back into that revenue generation, which is so critically important. There's only so long you can go on having a transit system that's not collecting any revenue, and we want to get back to that. So just a little forewarning there that we're coming very close to that opportunity, and that'll also mean some boarding through the front, and you'll see some physical changes on our buses. So we've created a bit of a shield that is obviously see-through, but a shield for our drivers, so that as people come within that 6 feet range of them now, within that 2 meter range, that they're protected. So we're doing all the things to keep our operators safe. And of course, our transit users can keep safe by ensuring that they wear a mask if they are able on our transit system. So this is, again, the mode that we're going to be in this summer is that though things are permitted to happen now that we're entering into the province's stage 2, there is a lag in terms of when we can get stuff up and going. And a lot of that is actually the fact that we are having to bring back staff who are redeployed to help with some of the emergency pieces of this crisis. And some of those folks remain redeployed to assist critical infrastructure and critical services that are out there. And a couple of examples are, a tremendous amount of extra work in our long-term care facilities. The screening that has to happen for every single person that comes in every single day to our long-term care facilities means that we need some additional staff. And now with our visits happening, outdoor visits, physically distanced visits, but again, it's an added pressure to our long-term care facility staff, who already are very busy on a day-by-day basis, providing great care in our long-term care facilities. So we needed to redeploy some folks there. And certainly, my last comments before I turn it over to Dr. Tran, our public health colleagues have required a fair amount of redeployment of folks from other parts of the city of Hamilton to ensure that we can respond to this public health crisis in the way that we have. And that has been very successful here in the city of Hamilton. And that's in large part due to our public health employees, but they have been augmented by quite a number of employees from the rest of the city. So bear in mind that we are not at full complement in other parts of our organization yet, and nor do we expect to be that way for a little bit of time. So in that way, some of those services are just not coming on board in the same way you would normally have seen them in the summertime. So with that, I'll welcome Dr. Tran to our media conferences and turn things over to him.
Hello, am I on now?
There
Sorry.
you go. Go ahead, Dr. Tran.
Sorry, just for some technical difficulties. Thank you for having me here. I just wanted to echo some of the comments made earlier by the mayor and by Paul. Again, thank you for Rosalie and Georgia of providing excellent service in terms of broadening our messaging and communication to those um, to additional other members of our city, and as well as for our staff and those who have been redeployed from a number of different departments. Thank you for helping us. I do want to update in terms of numbers here. And so for our own cases, as of 9 a.m. this morning, we have 807 cases in Hamilton. That's up 6 new cases from yesterday at 9 a.m. So that includes 798 lab confirmed, as well as 9 probable cases. Similar to what Dr. Richardson has mentioned in the past, most of these, 89% of these, have actually been resolved. So there's only as a minority are actually active cases right now. And to date, that unfortunately also includes 43 deaths. On the good news, we currently do not have any institutional or community outbreaks, which means it's a great news for our city and that we're holding on strong with this. So that's the main update I have in terms of our cases and trends. I do want to shift towards some news and a campaign that we launched yesterday. So our Public Health Services Division has implemented a campaign focused on engaging those aged 20 to 29, the young adults. And we started this because we always look at trends, and we saw that this demographic were being overrepresented in terms of our numbers. At one point, they were representing 44% of our cases in a 10-day period. So we want to ensure that we engage these young adults. So our campaign is cleverly called Physically Distance Hamilton Style, and it's largely based on physical distancing. Um, so this campaign, it's really about engaging our young adults to in terms of messaging and in ways that really resonates with them. So we've tried to be creative, and we are actually looking at in terms of their input as to what they consider as the 2 meters of separation that would be physically distancing. And we're asking them to use Hamilton iconic items, which might include things like Tim Hortons a cup, where you see those bulldogs out there. Um, so there's more information on our website at hamilton.ca/physical distancing. We know that group isn't a homogeneous group, and there's subsets within that. And so whether that's young professionals, those working in other like retail jobs, students, so we'll be tailoring based on our platforms and our current networks to do so. So that's all I have in terms of an update, and I will turn back the platform back to our mayor.
Thank you, Dr. Tran. Thank you, Paul, for your updates. And just to kind of put a point on that last point you made, Doctor, I think, the incidence of cases in the 20 to 29 year bracket are somewhat understandable given the anxiety and anxiousness and desire for people to get together. But I think people in that age group need to be aware that not only do you get together, but you also go home to other people that you could very well end up spreading this virus to. So, be very, very mindful of the fact that you can carry the virus and not even know it, and spread it to a parent or a grandparent, or anyone else that is in more of a high risk situation. So you may be okay, and although your symptoms may not be severe, others will react totally differently and could very well be a life-threatening thing for them. So be mindful of that, and hopefully we can encourage you to maintain that physical distancing for those very reasons. Protect yourself and protect others from yourself that you may be coming in contact with. Before we go to the media, let me just give a shout out to Concession Street Business Improvement Area. They are requiring to physically distance like everyone else, but the BIA has done their BIA Sidewalk Sounds event, and they've done it virally. So you can go to the Concession Street BIA's Facebook page, where Sidewalk Sounds will be streamed live at 11 a.m. and 1 p.m. on the third Saturday of every month. So each show will last about 45 minutes. Go to the BIA's website on concession.ca to see a list of performers and dates. So congratulations to the Executive Director, Christina Geisler, and her team at the Concession Street BIA for keeping the music alive and continuing to attract attention to, a wonderful BIA in the city of Hamilton on Concession Street. And hopefully some of those locations are starting to ease up and people are starting to enjoy the ambiance on Concession Street once again. Also a shout out to Stony Creek Studio 22 Dance Company. With the dance classes now shut down right across the province due to the pandemic, Studio 22 is responding by taking dance lessons virtual using Zoom. So Dance Studio staff recently held a special drive-by recognition event for program graduates on what would have been the end of the season recital night. Dancers participated in an informal parade along Grays Road in front of the dance studio with decorated cars, posters, and costumes. So congratulations to Stephanie Gilvaire and her entire team at Studio 22. And we much appreciate everything that you're doing in terms of keeping the dance alive. I'm sure the virtual Zoom approach, I have a couple of nieces that are very much into dance, and they've been totally engaged in the process by dancing at home, but getting lessons over Zoom. And I think that's been a fantastic resource. What would we do without that technology today? And again, just to appreciate all of our frontline workers, our nurses, nursing home staff, cleaners, grocery store workers, truckers, everyone who's going above and beyond during the pandemic to keep our city functional, garbage collection, people that are maintaining the roads, and turning the power off and on when we're having storms like we're having, right now. Every once in a while we get a power failure, and the electric team is out there putting the power back into service. That's all being done to keep our city operating and functioning, and we appreciate all of that effort. On that note, Jasmine, I'm going to turn it back to you to go to media questions.
Thank you, Mr. Mayor. And I will just let the media know, I think we're having some audio problems with Dr. Tran. So for now, we'll just direct questions to Paul and the mayor, if that's okay. We could also wait if anybody wants to try for Dr. Tran after. But first, we're going to go to a question from Samantha Craigs from CBC Hamilton. So Samantha, you can go ahead.
My questions are actually for Dr. Tran. So I'm not sure how you want me to deal. Should I just email those to you then?
Sure. Let's just try Dr. Tran. Can you hear us?
All right. Maybe.
Maybe not. Oh, there he is. Can you hear us, Dr. Tran? Okay.
Sorry, I'm having troubles actually hearing anything anyone is saying.
I do have a question for maybe I'll just email you my question for Dr. Tran. I do have a question for Mr. Johnson as well. So the weather is nicer outside, and I am sure, like a lot of other Hamiltonians, have seen a lot of people hanging out in groups outside. In terms of bylaw enforcement, has the city eased off on that at all?
So that bylaw is still there, and we'll still do the education around it. I will tell you that our bylaw officers are now pulled in a variety of directions, and so whereas when things were pretty much closed down, we could focus a bit more on certain things. Now we're having to do a broad spread of enforcement activities. So it may not be that as many bylaw officers are focused in on things like our physical distancing bylaw. We haven't backed off that, and the reason for that is that physical distancing is one of those key elements that is required to stop this spread. And it is the biggest concern in terms of reopening, is that we will ease off on some of the things that we know work well. And one of the first things that works really well and is really fairly simple to do, particularly in open spaces, is to physically distance oneself. And then the second pieces are, we should all be by now having masks, getting masks and wearing masks when we can't keep that 2-meter physical separation. So yes, we are out, but I will say that we have more parking than we're enforcing. We have more things that are open in the community and happening in the community. And so our resources are spread more back to its looking at a number of things rather than just focusing on some particular things. And I think we just have to encourage the sort of peer work that is happening. And I think a lot of people have taken it to heart, but let's keep up that energy around not gathering in tight groups. I will say the thing that has added to complexity for our bylaw enforcement folks is that, of course, that doesn't apply in those social circles that we've been educated around from a provincial perspective. So there is the ability to be within 2 meters and to have a different kind of contact with folks if they're part of your social circle. So it's a little less readily available for us to say, this is a social circle versus this is a group of people. But I will say if there are large gatherings and groupings of people where it's clearly not a social circle environment, we are doing what we can and we are responding we're responding reactively to calls where people say, there just are too many people hanging out together, and we're being proactive where we can.
Thank you. I will email my other question.
Samantha, I think we're back with Dr. Tran, so you can go ahead with your question to him.
Dr.
Sorry,
Tran,
I can hear now. Sorry, I had issues with audio for a couple of minutes, and it was all muted to me.
Very good. Actually, I had so I'm wondering. There has been discussion about some of the new cases that we've seen have actually been kids and teenagers. I'm wondering if the 6 new cases would fall into that category, and also if you're aware of any kids who are in hospital right now.
Because so I'm not. Yeah, so I'm not aware of any kids in hospital right now. I think I don't have the specific breakdown of the last number of 6 cases. I do know that at times when we see, numbers like higher uptick in, same one we saw with the 20 to 29, but also with the kids, based on what I'm seeing in terms of cases, that these tend to be in a couple of different household clusters. So if you happen to have, 1 or 2 households, which we've seen in the last few days, and they happen to be larger households with several kids, and they all get tested and they test positive, that will that really has been more explaining the more recent spike in the or recent increases in those numbers, those ages that are under 20, the children under 10, as well as some of the teenagers have been isolated in a few larger households. So we keep an eye on the trend to see if there's anything else happening in school-age kids outside of that, but we haven't seen that. They've been isolated in a few different larger households.
Thank you.
Thanks, Dr. Tran. Next question will be to Matt Ingram from CHCH. Matt, you can go ahead.
Hi, thank you very much for taking my question. My question is also for Dr. Tran. I was wondering if you could tell me a little bit more about the 43rd death. We were at 42 for quite a while. Can you tell me the age, the gender, and is this connected to the Roslyn?
So I know that we had a recent death over the weekend that was from the Roslyn. I'd have to sort of check that. I also will acknowledge that because we've had some questions today, that since 9 a.m. we've had an additional death also from the Roslyn with an 87-year-old woman who died in hospital today. I'd have to check in terms of the details of the 43rd death. My recent recollections has been a few of our recent deaths have been related to the Roslyn outbreak.
So following up on that, could you, if you need to check back on the 43rd, can you tell me some more about the 44th? How many deaths is this now connected to the Roslyn? And was she died in hospital? When did she die in hospital?
So died today, so that's why it's not captured in our numbers yet, and they will be updated tomorrow. My understanding, I believe it is the 16th death. I'd have to verify that.
Okay, thanks, Dr. Tran. Next questions will be to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question today. I'm looking to find out how many restaurant patio applications have been turned down. The Premier today was actually asking for a justification from Mayor Eisenberger for why restaurant patios are being closed, are not being approved here in Hamilton.
So my understanding is some 70 restaurant locations have applied and been approved, and 7 or so, as I understand it, have not. And it was largely as a result of the requirements that we put in place regarding the zoning. So the zoning had to be accurate for that to happen, and it was not to be adjacent or immediately adjacent to a residential area. And so those that did not, that had those circumstances weren't approved, and I think a couple of them that you've heard about, kind of fit that category. And I think you can imagine the complexity of all the locations around the city in terms of restaurants that might infringe on residential areas or not have the proper zoning in place to allow them to go forward. It's a bit of a complex issue. I don't think we can potentially open up every location for outside patio. It's really intended to allow those that already had a patio to be able to utilize them and expand them if they could, given those restrictions. So my understanding is, to get back to your question, some 70 have been approved, and 7 or so have been denied, as I understand it.
Okay, that's great. Thank you very much. And I was also looking to see, as we've now had a short amount of time in stage 2, have there been any problem areas that you found so far? Is there anything where, you would raise concern or would like to get a message out to the public?
Paul, I'm going to let you handle that one in terms of what
Sure.
you might have seen out there. I'd be happy to address it as well.
So I think there's 3 messages. One is that the first message is that people are doing a very good job from what our feedback is. So rather than focusing on the few little examples of where things aren't going well, what I am hearing back is that things are going well, and that people are understanding how how to maintain that physical distancing. We do see a healthy amount of masks being used, particularly in the indoor facilities, be they shops or malls. But I think we're doing well there. The second message is that I do think we need to increase, mask use wherever we're not going to be able to maintain that physical distancing. And then the third piece is that there are still some things that are coming back online, and the community continues to push the envelope, particularly around our waterfall areas, that we are exploring to see, how we can allow some access to that. But, they still remain closed, and people continue to still go there and try and force the issue there. And I think what we would want to say to folks is, focus on where you can go and what is available. There is much more available to do in our community this week than there was even last week, and certainly a few weeks ago. And it's a bit of the message that I'd like to get out, which is focus on what you can do, not what you can't. And that way we'll continue to be able to open the things as we go along. It just all can't happen at once. And if I could add in a 3A, it's just a little bit of patience. We're going to get there in the next few weeks with some additional things that are opening up in terms of pools and in terms of some of those sports fields, so that kids can get back to some of their activities that they would have started probably late May or into early June. So we're a month and a half late, but it's coming. And please just be a little patient with our folks and our staff in particular, and we're going to get there.
Great, thanks, Paul. Next question to Joey Coleman from the Public Record. Joey, you can go ahead.
So my question's to Dr. Tran. Looking at studies that came out after SARS, we know that closed ventilation systems are a risk for spreading airborne diseases. We know that public transit is cited as a place where that's a higher risk. And we know that having outside ventilation air circulating in outside air is one of the ways of preventing spread. It can substantially reduce the attack rate. What steps have been taken by public health as it relates to HSR buses, air circulation, air conditioning, and ensuring that they're not a place where an outbreak could occur?
Thank you for your question, Joey. I haven't worked specifically with the HSR about ventilation. I know that we've had some good communication and dialogue recently in terms of mass use and mass distribution, and then we'll be working towards finding and collaborating in terms of a solution that will help that. I think that the whole the science on ventilation in terms of transit is a bit tricky, and I think you have to. I would agree in general that ventilation and appropriate ventilation does help reduce the spread of COVID. I think in some of our earlier messaging with with um, of, with other areas of transportation, when we have someone who has COVID, general in terms of both physical distancing of having people when we talk to taxis or darts about, ensuring physical distancing within any sort of transportation system. So I think that the HSR has definitely put those measures in place to support that. That's still the key message is physical distancing, and then when you can't with mask ventilation is it can it's a bit more complex. We'd have to look into that further because um, I think it also depends on how the sort of the wind and the direction. That it's not necessarily that open windows is always better. So I do think we want to focus not on the ventilation within the HSR. I think it's the appropriate steps that are being taken, physical distancing and separating out riders, which we've seen sort of developed part of the HSR strategy, finding ways to encourage or I guess requiring use of masks, and then looking at any sort of ways to support and promote a mass use among transit users. So I want to thank the transit department and programs of doing that. But if we find any additional recommendations on ventilation that would be useful for our transit colleagues, we'll be sure to work with them.
Sorry, I have a fire alarm here, so I'm done my questions. Thank you.
Thanks, Joey. So we do have a bit of time, so we can go through once more. I'll go back to Samantha to start. If you have a follow-up question, Samantha.
No, I don't think I do actually. Thank you.
Okay, thank you. I'll go back to Matt. Matt from CH, if you have a follow-up question.
Thanks, Jasmine. I actually emailed you the question that I asked Dr. Tran before, the details surrounding the 43rd death. So perhaps he could get back to me on that.
Yeah, we'll follow up with you on that one for sure. No problem. Okay, we'll go to Joanna. If you have a follow-up, Joanna.
That's 5 years down.
Hi, thank you. Today at the Premier said today that, well, actually, sorry, I think it was Dr. Williams said today that individual public health departments will have the chance to make masks mandatory in the community if they feel that that's something that's necessary. Is that something that's being considered at all in Hamilton?
If it's to me, I mean, we are not looking at making masking mandatory in the community. I think we have a generally good uptake. We still see a low number of cases, and we will focus our efforts towards continuing to encourage it. Mass use of physical distancing isn't able to happen, as well as continue to support physical distancing. We don't have any immediate plans on any mandatory mask use broadly, other than I guess supporting our transit division.
Okay, thank you. We'll go back to Joey Coleman for a follow-up question from Joey. Go ahead.
So continuing on the bus ventilation issue, this will be to, I guess, Paul Johnson on an operational side. So the city has Nova buses, which recirculate the air, and the air moves very quickly throughout the bus. So there's a steady flow of the air that spreads air further than physical distancing requirements. There's also the challenge that the buses overheat without the air on. What procedures has the city put in place in terms of when to use air, when not to use air, and has the city installed better filters in the air system, for example, because the air does circulate within those buses?
So the focus from a HSR perspective is knowing that we are going to get more people on the buses and all of that circulation piece, but more importantly, the fact that we weren't able to keep the physical distancing. We weren't going to run buses at 10 passengers only or 15 passengers in the larger buses. The focus has been on the mandatory masking side, quite frankly, and that is where those efforts have been, protecting our operators with the bio shields. In terms of the mechanical side of the buses, I've not heard that there's been any changes mechanically to the buses, either with the filtration system, which I'm not sure would filter out what we're talking about, but I haven't heard of anything to do with the filtration system. And I think Dr. Tran's answered the piece about circulation of air within the buses. I mean, we'll continue to monitor these things, but where we did know that we wanted to go right away was in terms of having more people on the buses, and particularly having people boarding through the front again, and took two measures. One is to protect the drivers with a physical barrier, and the second was to mandate that masks be worn if at all possible. The only reasons you shouldn't be wearing a mask on an HSR bus is if you medically cannot, or you are not able to remove the mask on your own. Those would be the only two circumstances where we would want people not to be wearing a mask, and we're going to go with those measures at this time and continue to monitor any other steps that we need to take from a mechanical perspective.
Thanks, Paul. So I'm going to go back to Dr. Tran. I think you can answer Matt's outstanding question now. So we'll go back to you on the question around the 43rd death.
Yes. Thank you. So the 43rd death occurred, is also related to a resident or a former resident of the Roslyn retirement home. This is an 86-year-old male and passed away in hospital on June 20th.
Great, thank you. So with that, Mr. Mayor, we'll hand things back to you for some closing remarks.
Thank you very much. I am actually quite pleased with, I think we all are, with how the community at large has dealt with this issue and continues to. And anecdotally, I see many in our community wearing masks in appropriate locations inside of stores. Where it's hard to physically distance. So I think people understand why it's important to keep that physical distancing, and why that masks might be appropriate in certain locations, and certainly why mask would be appropriate on transit system. I think is understood as well. So we're seeing excellent effort, and that excellent effort has gotten us to stage 2. And one of the things that Paul talked about earlier that I'll remind people of is we don't want to have wasted all of this great effort to get here, including resources that both the federal and provincial government have put out to keep people isolated to help curb the spread of this virus, and the great job that we've done to date. We certainly don't want to waste by relaxing too much around that physical distancing, whereby we're starting to spread of this virus all over again. So I think people are, and hopefully will remember that this virus is still very much out there. You can be a carrier and not know about it and spread it to others. And so if you contain yourself within your social group of 10, you can't have multiple bubbles. It's not a group of 10 over here and another group of 10 over there. It is one group of 10. If you can contain yourself to that, then we can minimize the spread of virus going forward. And the data will tell us whether or not we're being successful. So hopefully a couple of weeks from now, we'll have a better understanding of how this is working out, and whether or not we can continue to proceed to other phases going into the future. So I would say, folks, you've done a terrific job. It's been difficult, anxiety filled for everyone, but we're in a good place right now, and we want to stay there. So don't relax too much. Make sure you listen to all the requirements that public health is suggesting to you, and we'll keep working on areas where we can relax those rules and give people some opportunity to enjoy the city as they would like to going forward. So thank you all for your ongoing effort. And for today, let me thank Bill Custers and Cable 14 for their ongoing effort to make this broadcast work, and to McLean Media that helps us ensure that these media availabilities run as smoothly as possible. I have nothing else to add other than looks like blustery, stormy weather out there, and we're getting some much needed rain. So things can grow, and hopefully we can continue to enjoy a summer that's going to be different. Not the same kind of summer that we've been able to enjoy in the past, but still one that we can enjoy, should enjoy, and find a way of enjoying, in our city. So thank you all for your efforts and continued good health. And let's continue the good work we've been doing over the last 3 or 4 months. Thank you all.